All right, clinical psychology. What is it? It is a branch of psychology. There's so many different branches of psychology. You got forensic psychology, uh, counseling psychology, informational psychology. There's so much out there, so many different branches of it, and it has to do with everybody. It has to do with everything because it's our minds. It's the way we think. It's everything. So even if you're not interested in psychology, um, you have psychology. I mean, your mind, the way you think. Clinical psychology specifically has to do with assessing and treating, specifically treating behavioral and mental disorders. And there's so many different kinds out there, and I'm going to get into it. So the clinical psychologist role, they specifically, they conduct psychological assessments of people. Most of the time, people with mental disorders or either struggling mentally, or things like depression, anxiety, or even you can start from your doctor. You go to your primary healthcare provider, say you need to go to therapy, and then sometimes you can go to a clinical psychologist, to see what's really going on in your mind. They provide psychological therapy, they diagnose mental illnesses and disorders, and they promote mental health wellness. So the clinical psychologists, they're kind of the ones who, they kind of diagnose you with what you have. So maybe you could be feeling depressed. Maybe you actually don't have depression. Maybe you don't meet the qualifications of it. And sometimes on the other hand, you will. Like, there's certain like qualifications that you need to have, and they kind of make that judgment call. They kind of make that call to see the diagnosis they go off of. Other studies want to learn to diagnose people with illnesses and disorders, not in a bad way, but just so they can treat them the right way and then get them to the help that they need. Maybe it's like get them to a psychiatrist, or maybe just they just need therapy. But they kind of diagnose you so they can help you with the next steps of where you can get help at or where you need help at next. What it takes to be a clinical psychologist is, of course, you need a bachelor's degree, you need to go to college, but then you also need a doctoral degree, you need a PhD in psychology or a Psych D in doctor of psychology. Then you also need an internship when you're supervised clinical internship, and then you also need to pass the state exam to receive your state license. So I mean, obviously, it's a very important role when you're diagnosing people with mental health, um, with their illnesses and disorders. So I honestly think that it would be a disservice to just, let anybody into the profession, because you really need someone that really knows what they're doing, really has done the time and the work to really study it and really know how to help people, because this is people's mental health that we're talking about. This is people's mental health that, it's not a game, it's not a joke. Like, this is very serious, and we need to get people the help that they need the right way so we don't, make things worse, because people, they can't survive. They can't even go through a regular day with some of these mental illnesses and disorders. So we need to get them the help they need so we can get them, living life comfortably and with this burden of whatever mental illness or disorder that they might have. So the skills and traits that a clinical psychologist, possesses, obviously you gotta be empathetic. You gotta love helping people. I feel like in this profession, you really have to have that passion. It's not something that you just do for money. It's not just something that you do for, you know, just for a job, just to, have something to do. This is something when you really empathize towards people, when you want to help people get better, get back on their feet and get where they need to be, get so they can go through a daily life, eat regularly, go to sleep, um, go to work, have fun with their kids, whatever it may be. Obviously, ethics, communication skills, active listening, critical thinking. Obviously, you're gonna have to listen to people. Maybe some things you may not agree with, maybe some things you may, um, that may just like be like, whoa, you feel me? But Um, yeah, it's just like you're gonna have to listen to people. You're gonna have to critically think on the spot of how to respond to these people. You're gonna have to know what to say, what not to say, how to diagnose people. So you're really gonna have to do the critical thinking of how to help this person, what they need, what may be going on with this person. You're gonna have to have great communication skills because you're gonna everyone's different. You're gonna encounter so many different people that are going through so many different things, and they're coming to you, the clinical psychologist, to really, like, get help, get them back on their feet, get rid of this problem that they're having. So it's really gonna take a lot of just gotta be real careful, real precise with what you're doing um in this role. Their responsibilities also, both individual and group therapy. You can sometimes be family therapy, couples therapy, individual therapy, or a large group therapy. Um, what they also do, they um, evaluate their progress of how they're doing. They look at when they first came to them and how they're doing now. If they're making progress, getting better, getting worse. They also do treatment planning, so they plan out their treatments of you're going to do this, this will help you try this, different practices and different activities for them to get better. Maybe just kind of figure out and dive deeper into what is wrong with them. Maybe it's something with their past. Maybe it's a trauma thing. You never know. Also, just like progress evaluation, also a psychological evaluation and testing, seeing where their mind's at, seeing if there's something in their past, something that is really wrong with their brain that you can figure out why. So then we know how to treat them. Obviously, it's a lot of note taking. When it comes to psychology, it's a lot of note taking. It's not just you're talking to someone, you just kind of figure it out on your own. And you know what I'm saying? You just like think of it on the fly. No, it's a lot of note taking so you can look at the progress, look at what they're telling you so you can know and have access to what you really need to do to help this person get better. And obviously, provide mental and psychological treatment. This is very important because this is who they come to. You can't really get this from your regular doctor or urgent care. You have to go to a psychologist or a therapist for this. And this is why it's really important. Why school and all the time and all the studies is important so that you really know what you're doing because this is people's mental health we're talking about. Common mental health conditions that are treated of anxiety or disorders, depressive, eating, personality, trauma-related disorders, and so many more other disorders. Um, I mean, even people who aren't really diagnosed even go to them. So they treat people and they just try to help them, try to get them what they need so they can get back on their feet and so they can live comfortably without having this burden. Like I said, types of treatment approaches that clinical psychologists use are CBT, DBT, which is something I work with personally right now. Also, things like psychodynamic therapy, family and group therapy, etc., exposure therapy. There's so many different therapies out there. It just all depends on what the person needs. And it's not a one size fits all thing. Everyone is circumstantial. Everyone's got their own needs and own things that work for them. Some people might even need medication, which comes to psychology versus a psychiatrist. With a psychologist, you need a doctoral degree, provide psychotherapy, give behavioral treatment. A psychiatrist, on the other hand, is when the medication comes in the medical. They prescribe the medication, give you the medical evaluation because medicine is very, very important. Medicine is very, also, what's the word? Like, you have to be very precise with it as well. It's a dangerous thing you're doing. You can't just prescribe anything to anybody because obviously medicine affects your body. It alters it either positively or negatively. So if you give someone the wrong medicine, you make things a lot worse, especially when it comes to mental health. Career growth. This field is growing rapidly and increasing in demand. Everyone needs somebody. Everyone needs help with their mental health, to some capacity. Like they need to do things like to maintain their good mental health, or they may need a little help from a psychologist. There's also a big growth in mental health awareness. It's becoming a more popular thing and a more like they're shining a light on it more because it's always been an important thing, but now people are really recognizing how important it is because everyone has mental health, you know what I'm saying? So there's also a competitive salary, increase in salary in this role, and there's diverse specialties in the field. There's so many different specialties of what exactly psychologist you want to be, or as clinical psychologist, you can specialize in anything, any specific disorder or anything like that. The salary clinical psychologist on average makes around like 97,000 a year. And the psychiatrist, obviously you're dealing with medication, the medical aspect of it, that's a little bit more, 250,000 a year on average. And the higher salary, like I said, because of medication prescribing and medical training, which is a lot more training. The impact on society obviously improves the quality of life. If everyone's happier and everyone has a better mental health, there'll be a better quality of life. Supporting emotional and mental well-being, again, that empathy that I was talking about, promotes a healthier community and reduces the stigma on people on what they think about mental health and these disorders and all that. Conclusion, clinical psychology improves the overall mental health of people. It requires extensive education, training, and practice, of course, because you wouldn't just want anybody to be dealing with your mental health and your medication and your treatment. It improves mental health by evidence-based treatments. So these things aren't they're not just trying stuff out of nowhere. These things have been studied and they've been practiced, and it's just as important healthcare profession as any other doctor. Taking care of your mental health is just important as taking care of your body. So this is a clinical psychologist.